Hello. We are a group of 5 members named here. We will tell you about types of joints in body. Here is some background knowledge. There are 270 bones at birth in human body. They fuses as we age and decrease to 206. 360 joints in our body. Functionally 3 types of joints present in our body. 1. Synarthrosis. 2. Amphiarthrosis. 3. Diarthrosis. Synarthrosis. They are fibrous joints and fixed joints. They are immobile, have no joint cavity. Example are sutures, gum poses. Sutures are in cranium. Gum poses are in between the teeths. Second type is amphiarthrosis. They are cartilaginous joints. They slightly movable. Bones attach by hyaline or fibrocartilage. Depending on type of cartilage, they are of 2 types: primary and secondary. Primary amphiarthrosis. They only involve hyaline cartilage. These joints may be mobile or immobile. For example, between epiphysis and diaphysis of growing bone. Secondary amphiarthrosis. They involve both hyaline cartilage and fibrocartilage. They are slightly mobile. For example, symphysis pubis. Coming toward third type, diarthrosis. They are synovial joints and freely mobile joints. They are the main functional joints of the body. They have the joint cavity which has synovial fluid in it. Synovial joints are further classified by the type of movements they permit. There are 6 classifications. 1. Hinge. 2. Saddle. 3. Planar. 4. Pivot. 5. Condyloid. 6. Ball and socket. How coming toward joint surfaces. Joint surfaces are defined as ovoid. Ovoid is concave and convex articular partner surface, for example hip joint. Sellar. Saddle shape with each articular surface having a concave and convex component in a specific direction. Knee joint is sellar joint. 2 other types of ovoid joint. Unmodified ovoid. Ball and socket orientation. 3-degree motion.
Saddle joints are also known as sellar joints. These highly flexible joints are found in various places in the body, including thumb, shoulder and inner ear. Basically, इस joint में हमारे पास एक bone kind जो होता है वो concave होता है, दूसरा जो होता है हमारे पास convex होता है. If you look at the examples, तो हमारे पास एक example आती है sternoclavicular and the other one is trapeziometacarpal joint. The next joint is ball and socket joint, a joint in which the rounded surface of a bone moves with a depression on another bone, allowing the greater freedom of movement than any other kind of the joint. For example, shoulder and hip joint. Shoulder and hip joint होता है, इसमें एक जो होता है वो round होता है और एक जो होता है हमारे पास socket like.
Hinge joints are synovial joints that are found in our body. The hinge joints of the body include elbow, knee, IP, interphalangeal joints of the hands and foot, and also the tibiotalar joint of the ankle. So here we can see the elbow joint is a hinge joint. Similarly with the knee, ankle and IP joints of the hands. Planar joints of our body have limited ROM and do not involve rotation. Planar joints are found in carpal bones in the hand and the tarsal bones in the foot, as well as between vertebrae. Here we can see the carpal bones of the hand and the tarsal bones of the foot, and also the vertebra over here.
Condyloid joints, also known as ellipsoid joints, are composed of an egg-shaped bone known as condyle that fits into a similarly shaped cavity. Although it sounds similar to ball and socket joint, condyloid joints only allow for forward, backward and side-to-side movements and do not allow rotation. For example, we have a wrist joint, metacarpophalangeal joints or interphalangeal joints, and the joints between the base of index finger. Pivot joints are joints that permit rotatory movements of bones around a single axis. Pivot joint is a synovial joint in which the ends of 2 bones connect. In this joint, a cylinder-shaped bone rotates inside another ligament that forms a ring around the joint. For example, we have the neck joint and the radioulnar joint, the joint between radius and ulna, and the neck joint that allows only the rotatory movement of bones.